Thanks a lot there, David. Well, could there be changes in the nation's healthcare system in the new year? Louisiana U.S. Senator Bill Cassidy says even though his healthcare bill failed to get any traction, he believes Congress will address issues like pricing in 2019. Rob Masson explains in this report.
Though his health care reform package came up short, this doctor and Louisiana senator is not giving up.
Change is coming in health care. The American people are upset.
Bill Cassidy is an optimist by nature and went before the leaders of Louisiana health plans this afternoon to talk about tweaks in health care, which he says must be made.
If you give the patient the power, the things tend to line up for the patient. If you give some other stakeholder in the healthcare ecosystem the power, things line up to serve that stakeholder.
Cassidy says one way to give patients more power is more transparency.
So what we've gone back and on a bipartisan basis come up with a lot of different ideas, like price transparency. Someone knows the cost of a test or a procedure before they get it done, as opposed to getting a bill 6 weeks later.
Cassidy's push has support from health plan providers who met at the Roosevelt today.
We were talking about surprise billing or balance billing or even, the regulation PBMs. Those sorts of issues are very critical to consumers. And we want to help formulate and give the senator some advice and some thoughts on how he can do, how the legislation can improve a little bit better.
Cassidy also wants to see steps taken to provide mental health care to newly released prisoners, and today met with a federal judge on that issue.
Having somebody who's doing well, will get a job, and pay taxes is far better for the safety of the street and the good of humanity than it is for somebody to have 6 weeks or 6 months before their first appointment, and they're going to do something because they're off their meds, and they land up back in jail.
While Cassidy looks to tweak his health care proposal, some say total reform is dead.
I think that there will be some tweaks to it. I think if you're looking for a total comprehensive piece of legislation, then you're not going to see that.
So what we've gone back and on a bipartisan basis come up with a lot of different ideas, like price transparency.
And Dr. Cassidy says he's once again ready to be heavily involved in new health care reform legislation. And Senator Cassidy says he's also working with the Trump administration in an effort to lower the cost of medicine, though few specifics are known at this time. Kim?
All right.